I think when the pandemic initially started, certainly none of us knew what to expect. And we were hearing reports out of Italy and out of China of certainly a very severe disease. And so the first instinct is to stay away from it. And that instinct for the providers was totally overcome, and it's instead to go take care of the people that need the care at the time that all of that's breaking. So while we witness everybody else being able to hopefully stay home and stay out of it, all of the providers, from our front desk receptionists to the nursing staff to the faculty and the students, really put themselves in harm's way to be able to be there and take care of people that they knew were going to need the care.
So when COVID first hit, I think it was just disbelief that what we were seeing happening in China had actually arrived in East Tennessee. So our initial response was to come together and figure out what we needed to do for the community and for the people of East Tennessee. And so our initial response was what people needed was testing.
When the idea came up of the mobile testing site, we hadn't done it before. We don't have facilities for that. We're not a drive-through restaurant. So we had to figure out, how do we get the tents? How do we get traffic flow? How do we deal with the safety of the patients and the safety of the staff and the volunteers that were there to do it?
The first thing was, it's a lot faster pace. I mean, you're pushing patients through trying to get as many people as you can tested during those few hours that the tent's open. And they're going to them and swabbing them. They don't know what to expect. They don't know what the swab's going to feel like when it goes into their nose or their mouth, depending on what kind of swab you have. And they don't know what to expect.
I don't think we ever really saw a time when the frontline providers weren't really still manning the lines and even finding ways to get out there even more. So we really tried to encourage people that didn't need to be out to not be out risking transmission of the disease. But I think all of the providers are very committed to their jobs and committed to their patients and committed to the community.
You go into training and you spend years preparing for things like this. You don't expect it to ever happen, and then you're right in the middle of it.
Well, I'm very proud of ETSU Health's total response to the pandemic. We recognize the education needs in the community, and we're very motivated to getting information to the public, the College of Public Health. Very proud of the healthcare in the region, for which ETSU, the Quinlan College of Medicine, have been very instrumental in developing. I think the healthcare education aspect of ETSU Health has made a difference in vaccine uptake and vaccine receipt. There's more work to do. There's more education to be done. We're committed to the education, and we'll keep working on this on a daily basis.
You know, I think that this experience has taught me that there are heroes all the way throughout every aspect of our community. They are the people that continue to do their job even though it's hard. They're the ones that step up and do extra when it's needed. And we're very lucky to live in a community where it's very easy to find lots of heroes.